I'm Juliet Gellatley from Viva and was really interested to hear the results of your work today. And I just wanted to ask, in terms of what exactly is it that you found in terms of microplastics being found in pigs and cows?
We did a pilot study on the presence or absence of microplastic particles in a low number of samples from cows and pigs. And we found in all of these samples at least some traces of plastics. So these are not the additives that we're talking about, which are more commonly measured, but we're talking about the actual particles themselves could be detected in these samples.
So this means what, that cows and pigs are absorbing microplastics from the feed that they're being given, which often, of course, has things like fish meal in it. Is that what you're finding?
When we look at the levels of plastic in blood, it's an integration of all of the different exposure routes, from breathing it in to swallowing it. So it could be from the air, water, or food. And different animals have different food sources, and some graze outside, some just get the food brought into them. So there's all these different routes, but this is a sort of integration parameter, what we're measuring in the blood.
Okay, and what are your health concerns with this? Obviously, in terms of people consuming pig meat, cow meat, dairy products, what are your health concerns for the consumer?
Our food chain and also the way we package food is full of plastic, and so there's a potential for plastic particles to reach our food chain. And this is just an extra step. We haven't looked at farm animals before, but we all care about farm animals and their health, and also people who consume farm animals or farm animal products are also concerned about the health of these animals. So this is really, we should see this as a first step in understanding how exposed these important animals are.
To summarise, this is the first study, as far as I'm aware, that has shown that microplastics are definitely in the blood of farmed mammals such as pigs and such as cows. And this is kind of the start of that work, and more work needs to be done to clarify the levels globally and what the potential impacts are of that.
Yeah. It's a signal to work towards a better understanding of the exposure. And one of the biggest chunks of work was really to get our analytical capacity up and running to be able to actually even see these. These are very low concentrations that we're working with all of our analytical power to see them and to quantify them. So now that we have spent this time working on the techniques, and they'll be further fine-tuned, and I think we'll only see a bigger power, analytical power in the future, so that we'll be much better at determining the exposure levels in wherever we want to look.
Okay. In a nutshell, basically, if you're consuming, I presume, the products from those animals, then you are consuming microplastics from them.
Yes, I think there's nobody left on the planet, human or non-human, that can avoid drinking around the microplastics or just not eating microplastics. And it's when it's in the air, water, and the food chains, we're all in the same boat, basically. We're all going to be consuming a little bit of plastic, making us a little bit of plastic on the inside.
I think there's a massive frustration from people all over the world in that you go into a supermarket and you don't actually want to buy into it, but it's actually very difficult not to, because it's everywhere on the products that you actually need. It's ridiculous, the amount of over packaging as well. Going back to the the cows and the pigs, I was just wondering, is there a phenomenon, do you know, like with PCBs and mercury, where the further up the food chain you go, the more concentrated it becomes, or is that not relevant with microplastics?
I think the biomagnification in the food chain is not exactly the same as with PCBs. But it's also interesting to look at that. I don't expect it to work in the same way as PCBs, but we haven't studied that aspect so much at the moment.
But what we do know is that the chemicals leaching out of plastics and microplastics in your lungs are attacking the immune system. So there is a massive response. One of the speakers earlier today, Ramon Peters, he told us that 50% of the air pollution out there is plastic already, and it's entering our lungs, entering our blood, and is really attacking our immune system. Which means that if we have 7 million deaths a year on air pollution, 3.5 million of them are caused by plastic.
That's incredible.
Yeah, that's incredible, and that's the whole lineup.
Where do you think this is going? Where do you think it's heading?
Now, we have to stop as soon as we can with overproduction. We have to produce less plastic and green chemistry. We must stop with adding all these softeners and endocrine disruptors in there, because that's attacking the unborn baby. It's in the placenta, so it's everywhere. So these little babies, it's going through the blood-brain barrier, and I think it's devastating what we are doing. So I call upon every government and every industry to stop doing this to our world. Use your common sense and preserve the world for extinction.
And do you lobby governments? I was just wondering in terms of what responses you have had in terms of, I mean, everything that you're saying makes absolute sense. It seems pretty impossible to argue with it.
I am no lobbyist. I am somebody who is creating a platform for scientists to bring their message to journalists and people all over the world. It's their message, and I respect, and I'm very interested in what they have to say to the world. It's not my message, it's their message, and I spread it.
Okay, and do you have hope for the future? What's your vision of the world in 10, 20 years' time?
I think we have 10 years left to turn the tide, because then there is too much plastic in the world. If we keep on producing in this tempo, then we are really, we don't give future generations an option. They are born already with so much defects, already in their bloodstream when they're even not born yet. That's very, very, very frightening. And we need Heather and other scientists. I invite you to see the speakers from this morning, and you will see that the evidence is piling up. It's getting more and more and more, and we must give them a stage. They must be heard.
So regarding health, which is obviously what a lot of people ask about, it disrupts, that it disrupts the immune system. Is there anything else that has been discovered recently in terms of its impact on human beings? I mean,
yeah, well, it's piling up. So probably there is the suspicion that it's increasing Alzheimer, that it's causing Parkinson, that microplastics and nanoplastics are attaching to pathogens, which is cholera and lepra. It's airborne. So when there are climate floods, when there is storm, and people are living in refugee camps or in low-income countries, they get exposed to massive diseases entering their bodies from all sides, and that will cause I don't know how many deaths. So we must change our ways, and we don't have time anymore.
Sorry, I was just saying, I've seen the science in terms of where most of the plastic dumping, for example, is coming from in the oceans, and of course, most of it is actually from fishing. What is your message to the world in terms of the reduction of plastic? Because there seems some very obvious areas that governments can change things very quickly if there was the will.
This is the last question, because I'm called away already again. I would say to governments and industry, take your responsibility. Open your eyes. The World Health Organization, the United Nations, change your way. Listen to the people listen to all those people out there that are suffering from e-waste burnings, from kids living on dumps, from kids dying extremely young because they are exposed to illegal export of plastic, and they cannot get rid of it in communities. That stories will be told this afternoon. So it cannot go on like this. So let's stop. Let's join our forces. Let's change our ways, and let us listen to scientists. And now I really have to go. They're dragging me.
Thank you so much.
Okay,
it's
thank
a pleasure to talk to you.
Bye bye.
Bye bye.
Bye.